Wales officials have reinstated COVID restrictions a day before Christmas in a bid to slow the spread of Omicron. The Premier is asking residents who don't have symptoms to avoid getting a PCR test to ease the strain on the system. Joining us live now is the New South Wales Deputy Liberal leader, Stuart Ayres. Minister, thanks for your time. More than 5,000 cases again today. Did the government get it wrong? Should masks have been brought back earlier?
No, Gabriella, I think we're taking cautious, measured decisions. We've always said that we would set our conditions and settings based on the environment that we're operating in. I think it's really important to recognise that Omicron is different to what we've seen over the last 2 years, and it's appropriate that we're taking a cautious approach at this stage with the reintroduction of mask wearing for indoor settings. We've got our lightest touch density provision back in place around 1 per 2 square metres in our hospitality settings. But we're not restricting any activity outdoor. In fact, we're openly encouraging people to do more things outdoor as they're approaching the Christmas and summer break. This is about making sure that we make this transition to living with COVID. This is not flicking a switch where we can go from where we were under Delta to where we need to be under Omicron. It's going to take a number of weeks and months for us to move through this transition. And it's important that we stay calm, we stay focused, and we continue to provide good information to the public so they can make good health decisions and take personal responsibility for their actions.
Thousands of restaurants have had to close. This is going to keep happening next year. You've already changed the rules around close contacts, but will you have to review this again to keep more businesses open in 2022?
I think there's no doubt that we'll have to be constantly evaluating our settings. We've changed casual contact settings. We've updated our close contact settings. So in New South Wales, once you receive a negative test, PCR test, you're no longer considered a close contact. That will allow more people to participate in the economy. But what we will see with Omicron is more people getting infected. Now, the good thing about Omicron is that all of the early reports, we'd like to see more data coming from health to reinforce this position, but all of the early reports show that it's less severe, it's less likely to lead to a hospital presentation and less likely to lead to an ICU presentation. If you take into consideration that around 80% of the people that are currently in ICU in New South Wales at the moment are unvaccinated or have not completed a full round of vaccinations, you can see once again how important that is. But there's no doubt, Gabriella, that we're going to have to be adjusting our settings as Omicron moves through our community to make sure that more and more people can still participate in the economy, but at the same time, we're not unnecessarily putting people at risk.
That is promising signs, the evidence that is emerging about Omicron, but this was the time that businesses were supposed to thrive. Residents were supposed to be using their Dine and Discover vouchers, getting out as much as possible, but it's not the summer that we're all hoping for. What will the government do next year to make sure businesses can recover from this period?
Well, we still have a strong stimulus package that's in place to support businesses recover from COVID. That will continue to be in place. We've got a strong outdoor event program in Sydney, which we'll continue to push ahead with. It'll be set up and operated under the public health orders at the particular time. We're still proceeding with our New Year's Eve fireworks, for instance, at 9 o'clock and midnight. Largely outdoor settings, allowing people to get outdoors and still be engaged in that. If you are doing something on New Year's Eve, indoors, you will be subject to the 1 per 2 square metre rule and you will have to wear a mask. And we're going to have to continue to adapt to those settings as we move through this transitional phase of COVID. We can't approach COVID exactly the same way we approached it in 2020 and 2021. COVID is different, Omicron is different, and our settings will need to be different as well. We can't afford to have cement feet. We've got to keep adjusting.
Rapid antigen tests will soon be free for New South Wales residents and hopefully more available. Do you think it'll get to the point that they'll be required before attending a venue?
Well, we want to be able to provide free rapid antigen test kits to people. We've got to do a little bit of work around the procurement of large volumes of those rapid antigen tests. We're already seeing some constraint in supply into existing markets like chemists and things along those lines. So we want to be able to intervene in that market, do larger amounts of procurement and distribute that back out to the community for free. We'll work on that, particularly over this Christmas period, to get that up and running as early as we possibly can. The main reason for doing that, Gabriella, is to shift people who don't need to be in our PCR testing queues, who are there for peace of mind, over to a rapid antigen test. We used to think that 40 to 60,000 people was a really productive day doing PCR testing. In the last couple of days, we've seen 160,000 people. Now, that's leading to a slower response time on those PCR test results for people who really need that. So we've encouraged other states around the country to remove the PCR test requirement for travel. We think it's pushing too many people into a PCR testing line, which could do their work via a rapid antigen test. It's really pleasing to see that Queensland is looking to make that adjustment from the 1st of January. I would be encouraging other states to do the same. We do have to come back together as a nation, and we will have to adapt to these changes. So rapid antigen tests are going to be a part of that. The New South Wales government is going to supply more of those rapid antigen tests for free out into our communities so people can have that peace of mind without clogging up our PCR testing.
Should Queensland be changing the rules now?
I think it would definitely be beneficial if they did that. You're seeing thousands and thousands of people lining up to get a PCR test so they can travel into Queensland to see family and friends. That's putting pressure on the New South Wales PCR testing laboratory. So that means a healthcare worker who's trying to get back to work and work in one of our hospitals has to wait longer for their PCR test result, whilst a traveller or a tourist is trying to get tested to travel to Queensland. I think the priority should be focusing on those people who we need to get back into work, back into our hospitals, back into our schools, back into our economy, rather than having people sucking up PCR testing time just because they're travelling interstate.
Just finally, when will tourists be allowed back in Australia?
Well, I think we're working really closely with the Commonwealth around this. New South Wales has substantially removed all of the requirements around quarantine. There are some short isolation arrangements, PCR testing results where looking at whether that's the appropriate way of bringing people back in or whether a rapid antigen test should be used in lieu of a PCR test for those people returning from overseas. So here we're really trying to open the New South Wales economy up to people from across Australia and around the world. And when you've got high rates of infection already in your community, you've got to ask yourself, are you putting in those onerous restrictions for people coming in for no particular reason? That's something that we're constantly evaluating. But we'd like to see more people being able to come into Australia, more people being able to travel freely around Australia. Omicron is here, or COVID is here to stay. Omicron is going to spread more quickly around our communities. We need to be adjusting to that. We can't keep trying to solve a 2022 problem with 2020 solutions.
Stuart Ayres, thanks so much for your time this morning.
No, thank you very much, Gabriella, and can I wish you a Merry Christmas too?
Thank you.